So chapter 9 is all about looking at each joint of the body. Really, we're just going to be focusing on the main joints that we've covered already, like shoulder, elbow, wrist, hip, knee, ankle, that kind of thing, right? And the spinal joints. So we look at each joint and we classify it, meaning we classify what is it made of, what makes it up as a joint, and then how does it move. So when we talk about what it's made of, that's going to be called a structural classification. So chapter 9 joints is all about classifications. So we're going to have structural classes and we're going to have functional classifications. And even though it may sound a little fancy, you're probably already getting a little nervous. It's not really that bad at all. I promise you, it's not that bad at all. What is tough about this chapter is getting to know some terms that we've never seen before that refers to these examples of these joints. Because all that we've seen is the freely movable joints of the shoulder, hip, wrist, knee, that kind of thing. But we're going to see some joints that really don't move at all, right? And some joints that may move just a tiny bit. But all the ones that do move freely are the ones that we've done. We just haven't seen the ones that don't move so freely. That's where the difficulty comes in. But there's just a handful of those, so it's not too bad. So anytime we talk about structural classifications, we're going to look at three major classes: a fibrous class, a cartilaginous class or classification, and a synovial class. So just like the words indicate, guys, this is where it can be easy. I've discovered that it really depends on how you learn things. And that to me is the responsibility of the teacher. And of course, the communication as it comes across to the student. So this is the best I could do, the simplest way you could present it, I think. Which of these terms sounds most like fibers? Fibers. Which of these terms sounds like cartilage, right? And then what about synovial membranes? Right, so that already tells you what the joint is going to have in it. So if we say that a fibrous joint is considered a fibrous structural class, it means that that joint is only held together with fibers, meaning ligaments, meaning collagen. Right, so these types of fibrous joints are two bones, because all joints have bones, of course. Two bones coming together with only fibers holding them together, which we're going to say ligaments or collagen. So we're going to expect there to be fibers here, which is going to be collagen, right? And really what we're saying is ligaments. So fibrous joints will have collagen fibers only holding them together. And we're going to call those collagen fibers ligaments. For cartilaginous joints, what would you expect a cartilaginous joint to have in it? Cartilage. What would you expect a synovial joint to have in it? A synovial membrane, right? So all we're doing is adding to the mix. We're upgrading, because all joints, all useful joints, will have to have fibers. So we're going to keep fibers in the mix of all these. Now for the second one, we're just going to add cartilage. So the second class is going to have fibers in the form of ligaments, of course, collagen, plus cartilage. And the third class will have what? Fibers, cartilage, and a synovial membrane with a capsule. So we're really just upgrading it. Okay. That's what I mean about structural classifications. We're really just calling out what the joint is made of. We're going to see these unfold in the PowerPoint. Same old thing. I just like to put it on the whiteboard because sometimes I think it's helpful to see it twice. Helpful to talk about it, see where it makes sense. That is the beauty of the best way to learn, guys. If it actually makes sense as you're thinking about it, then it's going to be more easily learned. And thankfully for these, the words have not gotten too difficult yet. These are words that we've heard before mostly. So a synovial joint, structurally speaking, will have the fanciest design. Does everybody agree with that? It'll have the most structures keeping it together. And the more features you're gonna see in joints, the more freely movable and the more useful it'll be. Right? A cartilage that a joint that has no cartilage, what is cartilage used for? To reduce wear and tear, to reduce friction, that kind of thing on the bones, right? So for a joint to have no cartilage, what would be the reasoning in that? I mean, do you think that joint is designed for movement? Hell no, because cartilage is to facilitate free movement. So if a joint has no cartilage, we would not expect it to have movement. These are the kind of joints that we see in the skull. So where your two skull bones come together, can't tell that, but they're held together only with tiny little ligaments in between our suture joints. Okay, so we're gonna expect these joints with no cartilage, functionally speaking, to be considered synarthrotic, because that's the word we use for non-movable joints. So our first functional class is synarthrotic. Right? This is going to be no movement. No free movement, I should say. If I were to come around to you and squeeze your skull, and we measured the movement between the skull joints, you might see a tiny bit of motion there. I mean, minuscule, not enough to measure though. It's not like we can freely open up our skull and move it, right? So we'll just classically say no movement for this one. For cartilaginous joints, these joints do have cartilage, right? But they don't have a synovium. So they're kind of in the middle. They're meh or mid joints. We call that amphiarthrotic. AMPHI, amphi. Amphi, AMPHI, amphiarthrotic. Arthrotic refers to the movement in that joint. Synarthrotic is no movement. Amphiarthrotic will be slight movement. It's not designed for free movement. It's not designed for a lot of movement. It would break down. It's designed for slight movement. So we'll see certain joints that only have slight movement, like our disc joints in the spine. We cannot move those disc joints but too far because it would rip up the disc, wouldn't it? Right? You don't see vertebrae separating, right? Like the humerus does when it moves across the scapula. So disc joints are going to be an example of our amphiarthrotic cartilaginous joint.
So is that how you get like a slipped disc?
When it moves too much, okay. And you've overworked that joint capability. Yeah, the design's just not there for it. So the synovial class is the one that we've been working in. This is what we've been swimming in all the while, doing all these movements of the neck, arm, shoulder, hip, all that stuff, right? This is what's going to be called diarthrotic. Write that better. So diarthrotic joints are going to be our freely movable.
The one across from.
That's right. That's our association. We're going to say we're going to make that association that these are going to be associated together, those and then these. That's the game. That's why I like to draw like this, and I like for you to see it like that. Now, there always, guys, there always is going to be exceptions where there might be some small thing here or there that doesn't fit with the complete association, but guess what we're not worried about? We're not worried about every little rabbit hole and exception. We're worried about the standard, right? That's what we're looking. So based on how you're being presented here and how you're going to be tested, these are the associations that I need you to know. Fibrous joints will be synarthrotic functionally. Cartilaginous joints will be amphiarthrotic functionally. Synovial joints will be diarthrotic. So on testing and quizzing, you'll be asked to classify a joint. Is it going to be fibrous, cartilaginous, or synovial? And also, is that joint going to be synarthrotic, amphi, or diarthrotic? So you know if it's a fibrous joint, what's it going to be functionally? There you go. So don't miss the easy association, right? All right, we're just gonna look at some PowerPoint slides here to run through those examples. Guys, I know it's not the time for you to be memorizing stuff, other than what we just did. That would be, that's easy enough. But looking at the examples of all this, I know it's gonna take some time for you to, blend that into your head over the next week. So I will be going through some slides fairly fast, but just know it's just because I don't expect you to get all these new words right now in this hour. But starting off right now, this is just an easy example in this slide to show you what's expected in a typical synovial joint. So we're looking at the bottom class. And just so you know, this is what most of the chapter is going to be about. Oh, Jesus. No, not good. Most of our focus is in this bottom group here. And we're going to expand on the bottom group. In the bottom group of synovial diarthrotic on the board, we will subclassify certain joints. So we're going to go further with that and say, okay, here's the humeral joint, right? It's freely movable. Therefore, it's a synovial joint. It has a capsule. This example we're about to see here. But it's also called a ball and socket joint. The elbow, freely movable with a capsule, synovium. It's also called a hinge joint. So we're going to add one more class, a subclass, you could say, to the synovial joints, calling out whether it's a ball and socket, a hinge, a pivot, or a gliding joint, that kind of thing. Those are the words we're going to come into a little bit later. All right, so here's a typical synovial, guys, because that's what we're going to see most of. All the features you'll need to know. Obviously, it's going to be two bones come together. Check. There's ligaments connecting the bones together, right? Fibers, check. Cartilage ending on the ends of the bones, check. Synovial capsule here in the pink with synovial fluid inside. That's our characteristic of a synovial joint there, but it's got everything. So all synovial joints will have everything. Basic definitions for you guys. Any joint will be called an articulation where two bones come together. Whether they're movable or not, it's still a joint, okay? So don't think all joints move. A joint is technically when two bones come together. It could be fused pathologically. It's still a joint though, right? Even the growth plate, consider the growth plate. You wouldn't consider the growth plate a joint, but is the growth plate not a little piece of cartilage joining two pieces of bone together? Well, hot damn, that's going to be known as a joint too, right? Because anything joining two bones is going to be considered a joint. So you need to kind of liberalize your thinking when you think of that. Arthrology is just simply the study of any joint. Kinesiology, study of movement. Again, typical features of a synovial joint, just to let you know, this is what we're going to see most of. Here's our structural classes, guys. Fibrous joints have fibers, which are going to be ligaments. Cartilaginous joints have cartilage and fibers. Synovial has all three, a synovial capsule, I should say synovial capsule, cartilage and fibers, just like we put on the board. When we base it upon movement, remember, structural classes are all about what the joint is made of structurally, what makes it up. Functional classes are all about describing the movement. So don't get those two associations mixed up, of course. It's two different classifications. So a synarthrotic will be classically immovable, amphi slightly, and diarthrotic is freely. And here's the association from the board. Fibrous joints with fibers only, there's no cartilage, therefore it's not designed for movement. So these will be synarthrotic, no movement. Cartilaginous joints have some cartilage and some fibers. They're designed for some slight movement. That's why they're called amphiarthrotic. Synovial joints have everything, including a synovial capsule with fluid inside, synovial fluid, and that makes that joint capable of free movement. And that's why those joints are considered diarthrotic. So everything we did up to this point, like I said before, in case you missed it, the neck joints, all the spinal joints in the back, I should say, the ones that move a lot, those will all be synovial diarthrotic. All the joints we did in the arm and leg will all be synovial diarthrotic, right? And those are the joints we're going to pick on to go one step further and say, okay, This is a ball and socket in the shoulder and the hip, right? Given the nature of the structure of it. This will be a hinge for the elbow and knee. Our finger joints are also going to be hinge joints, right? And then gliding joints we'll see between the wrist bones because they just glide across each other. Pivot joint right there at the radius ulna. So that's just the extra classes we'll see toward the end of the chapter. And you'll be able to focus, soak those in over the week. Here's the most difficult part of the chapter overall, getting to know an example of each of these. So here we go. We're talking only our fibers class here. Here's your classic examples. And this is all you'll have to know for the test. It's new words, but it's not that much. Your sutures are going to be your classic example of a fibrous joint. We're talking about two skull bones coming together with only ligaments there to hold them together. And notice it says adult skull. Okay, this is important. In the adult skulls where we have these ligaments holding the bones together. Syndesmosis, that's a new word. This is going to be where we see just ligament fibers. So if we look between the radius ulna and the anatomical human, we'll see a sheet of ligaments in between the radius ulna here and between the tib fib and the lower leg. It's not really designed. It's not like I can take my forearm and separate the bones, can I? Can't do that. It does have a pivot movement here, right? The pronate, subinate. But I can't separate these two bones radius ulna, so there is no movement there. So this is classic synarthrotic, and it's called a syndesmosis. And if you remember anything about word association at all, a desmosome. Did we talk about that way back in Unit 1? These are just these are protein fibers that hold things together. So I don't know if you remember that, but syndesmosis, syn just means coming together. These are fibers that just hold bones together. That's it. And then gomphosis, that's an altogether new word for you guys, probably. This is the classification they give to teeth being plugged into the mandible or plugged into the maxilla to make your top and bottom rows of teeth. If you didn't know, enamel is just basically the same as bone. So in this case, these are your teeth joints. There's tiny little ligaments that hold your teeth into the joints of the mandible and maxilla. Tiny little ligaments, if you didn't know that. So there's all your immovable joints. For the slightly movable category, notice that there's some other verbiage up here. Don't worry about all that. Know this in the bold down here, okay? Cartilaginous joints, we're going to have some slight movement. The difference is we're going to have two types of cartilage being used. In the synchondroses category, again, a new word. We'll look at the word association. Syn means coming together. Chondro means what? Cartilage. Osis means a condition of the bone. A condition of the bone coming together with cartilage. This is our growth plate. So a synchondroses, in this case, it does not move, right? It's not designed for movement, really. So that is one of the exceptions you need to know. But the growth plate does have cartilage. What kind of cartilage does it have? Hyaline or fibro in the growth plate? Hyaline cartilage. So I should have written it here, but the growth plate is going to be hyaline cartilage, whereas the symphyses joints are going to be fibrocartilage. That's going to be the discs in the spine and the pubic symphysis we saw in the pelvis. So right here, guys, where the two pubic bones were joined together. Now you can tell that's not hyaline cartilage. There's a big chunk of cartilage here. That's fibro. This is a symphysis joint, symphysis. That's why it's called pubic symphysis. And we learned that before already. If you want to tear apart that word symphyses, sym means coming together. Again, physes in this case means the body of the bone. Fibrocartilage, right? Symphyses, the bodies of the bones coming together. What did we say this was called here? Besides being a lumbar bone, what part of the bone is that? The body. Remember that? So two bodies of the vertebrae coming together with fibrocartilage. That's what symphyses means. Sym means coming together. Physes means the body of the bone. So two vertebral bodies coming together. Symphyses, right? Or we look at the pubic bones. These are the bodies of the pubic bones, right there and right there. Two pubic bones coming together. Symphyses joint, right? Both using fibrocartilage. So for the bigger test, you should know fibro used here, hyaline used for synchondrosis, fibrocartilage used for symphyses. And once you get past this hurdle of these first two slides here with your examples of fibrous and cartilaginous, the rest of it does get easier. So this is the toughest part, these first two example slides here. Only because I've been teaching this or looking at it for so many years do I even feel comfortable with this, to be honest. I remember seeing this at first, and it was like, oh God, this is way too many words, way too many things to look at. That's why I said, break it down over the week that you've got, maybe a day or so, focusing on one or the other. Okay, but don't miss the easy. Don't miss the things that you absolutely already know. Sutures should be an easy one to remember for no movement, right? Don't miss that one. Consider that priority. For cartilaginous, I think it's easy to know the discs of the spine, right? Thick fibrocartilage. It's easy to know that one. And you're going to have some slight movement there. Now, the third class, synovial, this is where we get free motion from the limb joints for arm and leg, and then the spinal joints. We're going to see another collection of joints in the spine. Notice where we were for the symphyses joints. This is in the front of the spine. Now we go to the back of the spine. The back of the spine is going to give us all of the posterior joints of the spine. And look at these right here. All these, where the bones connect to each other like a puzzle, those are all joints in the back of the spine. And they all slide across each other. That's what's called the facet joints. So we don't know that word yet, but just know that we have smaller joints. Here's another example of them right here. Right there. Can you see a little joint space right there where the pencil is? Where the bones join together? Or if while you're leaving class, come by and I can show them to you. But where the joints come together in the back of the spine, these are called facet joints. They're going to glide across each other like this. So when you bend forward, they're gliding. Right? Each of these joints will have a little capsule, a little synovial capsule around it, with some fluid in it. Some ligaments all around it, of course. Those are the facet joints of the spine. So those are synovial, right? The disc joints are going to be cartilaginous. The facet joints in the back of the spine are going to be synovial. So that, you want to look at that real carefully. Again, here's all the features of a synovial joint. So think of a question that might be something like, which of the following is or is not a feature of a synovial joint? It's going to be everything. You know, everything we have is going to be part of a synovial joint. We're going to have fibers, a synovial capsule with synovial fluid, synovial membrane, and extra ligaments. It's going to have everything. If you've ever designed anything, think of yourself as a designer. If you want that joint to move as freely and best as it can, it's going to have a sophisticated design, right? If you're building a robot and you want that robot to have human-like motion, you're going to spend years detailing the design of that robot, aren't you? If you want that robot just to stand there, there's not much design that goes into that, right? So let that be common sense. The more features you have, the more movement you're going to have. Okay, so again, what kind of cartilage are we going to have at the edges of the bone, this articular cartilage? What brand of cartilage is that? That is our hyaline cartilage. And these synovial joints are going to, by the way, here now we're basically merging all of our thoughts back to synovial joints. Most of this PowerPoint is going to all be about this last class of synovial and diarthrotic movement. So we're going to have that fluid inside the synovial capsule. This is what nourishes the joint and keeps it moving freely. Therefore, if you don't move the joint breaks down. So let me say it one more time. Moving the joint correctly encourages the production of synovial fluid. Therefore, if you don't move the joint correctly, you don't produce synovial fluid. Does that make sense? So for people that are stiff, maybe their posture has just gone bad for a couple of decades and their upper back is just stuck. It don't move much, right? You see people move around like this, they're just, especially older people, they're just stuck. They're frozen, basically. Guys, there ain't no synovial fluid going on in those joints. Therefore, those joints every day are breaking down and fusing together, which makes them even more stiff. What's the way to fix that? Motion. Chiropractic can reverse arthritis to a certain degree. Once the bone's fused, of course, you can't reverse that. But if it's where the joints are just stiff, that is one of the major purposes of chiropractic, is to get the joints moving so that the joint can produce synovial fluid again to facilitate a free movement without breaking down. It's very important. It's the same idea as brushing your teeth. You brush your teeth to get all the particulates out of your mouth, right? Whether you use toothpaste or not, brushing your teeth is something. Even eating an apple is considered, in a small way, brushing your teeth, because it's adding good pressure against the tooth to clear away any bacteria. In the same way, movement of the spine is absolutely necessary. It's not an option. It's not an option to go to a chiropractor. It's a necessity to get your spine moving so it doesn't break down. It's just become an option in some people's brain because they only think it's for car accidents. It's actually to keep you moving in general. Okay. So this is a real shoulder joint here, a real specimen. You can see where we do have a joint cavity. The capsule would be surrounding all this shoulder here. We can't see the capsule in this picture, but we do see the ligaments and the tendons that support the capsule. There's our supraspinatus as an example above the joint. That's kind of cool, showing you how the tendon attaches right there to the greater tubercle. That's a cool shot. We're going to see some special features in synovial joints. So this is one of our second objectives here in the whole chapter. Now that we've classified the differences, now we're going to see some extra special features only in synovial joints. Only in synovial joints, guys, you're going to see these. One of these is going to be a meniscus in the knee. A meniscus is another type of fibrocartilage. It's a thick extra cartilage in the knee that provides shock absorption. Another example of special cartilage is going to be the disc that's in the jaw joint, the TMJ. So these are special features that we find in synovial joints that are made of what? Fibrocartilage. We automatically are going to have the articular. It's a done deal. But now that we're just looking at, it's all about design again. If we're looking at design to make that joint more stronger and durable, then we need some extra special cartilage to do so. Why would we need the knee to be more durable? Because we're designed to walk on our legs, right? We're designed for that shock absorption of the knee. So when you run and all your body weight is pounding down on that one knee as you're running, the design of the knee must have some extra shock absorption to cushion that load coming down the knee. So that's why we have extra cartilage known as a meniscus. And you should know that it's fibrocartilage. Another area that gets a lot of stress is the jaw joint. So we have extra cartilage in the jaw joint because when you chew that steak, right? Or that 3-day old pizza, a lot of power is going into that jaw. You don't want to break that joint down. The jaw is extremely powerful. Have you ever bitten your finger before? you'll find out how strong your jaw is. It's crazy strong. Anyway, extra cartilage there, also fiber cartilage. So for the test in red, know these two, know where they're found, know what they're for, know what they're made of, right? Know where they're found in the knees and the jaw joint, know what they're made of, fiber cartilage, and what their function is for extra durability. And if that's just common sense to you, even better. If you understand the logic of that, the design of that, that's even better. That's magical. Another special feature we'll see is called a labrum. This is a rim. You know what a rim is, right? This is a rim of additional cartilage. We still have the hyaline, no doubt there. Got to have the hyaline cartilage to line the edge of the bone. But this is an extra rim of fiber cartilage, again, to increase the stability and durability of the joint all over again. So if I take my acetabular joint, right here, there's going to be some hyaline in there, absolutely. But I'm going to add an extra rim of fibro around the acetabulum to make it a deeper socket, make it more durable. That's what a labrum is. Same for the shoulder. So you tell me, where do we find labrum? Hip and shoulder. What kind of cartilage is it? Fibro. Why is it fibro? For extra durability. Fibro is a thicker, more durable cartilage. Last special feature is going to be a bursa or a tendon sheath. A bursa is nothing more than just a little pillow, a fluid-filled sac filled with synovial fluid. So where might we need a little pillow? Well, let's go back to that picture of the supraspinatus. Check that out, guys. Looking where the supraspinatus tendon crosses right on top of that bone, wouldn't it be nice to have a little pillow to cushion that tendon so it doesn't rub right on the bone over and over again, right? So there's actually several bursa in the shoulder to do that. There's one under the deltoid, one under the supraspinatus, one under the acromion rather. That's to cushion the friction, right? That's what a bursa will do. So let me show you the picture of the bursae. Bursae is plural. Look where you'll find them. The shoulder, the elbow, the hip, and the knee. Think of the design, guys. These are all the major joints of the arm and leg, where the most load would be placed, the most resistance, you could say. So what is a bursae? A fluid-filled sac. What's the purpose? To reduce friction, or to reduce wear and tear at these areas. Yep. So this is to reduce wear and tear, reduce friction. And of course, when we do get wear and tear, when we do get extra friction from overuse, we call that bursitis. So typically bursitis would only come to you if you overwork that joint. Now, there are times where you have other soft tissue conditions going on, like autoimmune conditions, which can inflame this, but you're like my mom. She came to me one day, Michael, I think I have bursitis in my shoulder. I'm like, well, Mom, you never move your shoulder. Why would you have bursitis there? It's so cute. Without any other complicated condition, you wouldn't normally get bursitis just out of the blue. You know, people just love to say they have pain there, so it must be bursitis. That would be just good old inflammation, but not the bursa. That's different. And if we take the same idea and put it around a tendon of the wrist or ankle, same idea, just to reduce friction, we're going to call that a tendon sheath. So a tendon sheath and a bursa is the same thing, guys. It's just a different shape. A tendon sheath would be more like a straw wrapper covering a straw, right? To surround these tendons in fluid to reduce the friction at the wrist and ankle. So in that case, the inflammation of that kind of a sheath would be called tenosynovitis. And people do get this, people that work, mechanics, surgeons, secretaries that type all day, this would be tenosynovitis. Golfers, you know, anybody that uses the wrist over and over again. A baseball player would absolutely get bursitis, right? Pitcher especially. Tennis player, you know, think of the use of those joints there. So let me review all those special features again. The meniscus and the disc in the jaw for extra support, right? This is fibrocartilage. More fibrocartilage in the labrum of the shoulder and hip. And then these bursae and tendon sheaths filled with synovial fluid, again, to reduce friction. Notice the common theme between all 6 of these special features is basically to help that joint reduce friction or wear and tear in some way, isn't it? That's the whole idea. If something is designed to reduce friction or wear and tear, then it should mean that that joint probably gets friction and wear and tear from overuse, right? So it's all about design. Notice we don't have bursa in the skull. Right? That's what I'm saying. It's just a matter of design. All right, here we go, guys. Some simple other additions. Tendons join muscle to bone. Ligaments join bone to bone. A bursa would be a fluid-filled sac with synovial fluid, same as a tendon sheath. These are just other accessories that we should know about the joints. There is actually one more structural class that I left out, and this is in the case of something fuses. Do you guys remember the growth plate? Does it fuse? Yes, it does. Therefore, when it was a growth plate, it was separated by cartilage, making it a synchondrosis joint, right? But when it fuses, the cartilage goes away, it dies off. So now you just got bone on bone. There's no ligaments there, it's just bone and bone together, a fusion. So what we call now a fusion is a 4th structural class that's not on the board, where we're going to call it a bony joint. This is where we have no fibers, no ligaments whatsoever. Therefore, it's called a synostosis. I know you guys are sick of the sin words by now. Thank you, Anna. Love your feedback. Sin means coming together. Os means bone. Osis means condition of the bone coming together with nothing, no cartilage, no ligaments, right? A syndesmosis was ligaments. A synchondrosis was cartilage. Now it's synostosis, it's just bone and bone. So if you pay attention to the word, maybe that helps. But this is a fusion, whether it's pathological or normal, it's still called a bony joint. In surgery, when they pull your discs out, maybe you got a blown disc, and they'll scavenge that thing out and fuse that joint down. In surgery, that will be called a bony joint because they took away the cartilage. So any fusion, whether it's pathological or normal, would be called a bony joint. We're going to see that in what we call the elderly skull. The adult skull, as we've learned already, has tiny little ligaments, and we'll call that a suture joint, right? Like we learned already. But in an elderly skull, that typical word elderly means that those ligaments will die, they'll calcify, and now you got bone on bone in an elderly skull. So when you see the term elderly skull, which structural class is it? It's no longer fibrous. It's going to be called a synostosis. An elderly skull is a synostosis, a fusion. Other fibrous joints will have fibers, cartilaginous, cartilage, and then synovial. So all 3 remain the same down there. We're just adding that 4th one now. The rest of the PowerPoint, guys, is about getting into those subclasses of the synovial. So I'm just going to skip through some of these. So here's some examples of your synostosis, by the way. Things that are immobile. cranial sutures of elderly, growth plates. Focus on those two. Two examples of a synostosis where we have a fusion between the cranial bones in the elderly and the growth plate being closed. So just focus on those two right there for a synostosis. There's just some pictures to go along with that I'm going to skip through. This is just a review of what we've already done. Maybe these pictures are easier to look at than the ones before. Here's your three classic examples of fibrous joints. If you want to build yourself a note card, maybe this is an easier way to look at it. These are fibrous joints, guys. Do we want to say where each of these are found? Where are your sutures found? Skull, gomphoses, teeth, very good. Syndesmoses. This was between the radius ulna tib fib. Okay. That sheet of ligament between radius ulna tib fib. So there's a picture of the ligaments in the skull. There's a picture of your ligaments between tib fib. Right there. See, no cartilage, just ligaments. This is why it's fibrous. And there's your ligaments in the teeth joints right there. For cartilaginous class, we're going to have these two. Synchondroses will mean it has cartilage. This is our growth plate. Symphyses, where do we find those? Pubic symphysis and anterior joints of the spine, the disc of the spine. Very, very good. See, this stuff is very, I think it's easier to catch up on if you think of the design. The words just mess with your head a little bit, but realize none of this is in lab. None of this is in your stations. It's all on the paper tests. Okay. So our two, there's a synchondroses there. The growth plate is the one you got to know for the synchondrosis. And then the symphysis is going to be right there, the disc of the spine and the pubic symphysis. These are just pictures to show you what's going on. Just trying to go fast here. Okay, here's our other classes, guys, the subclasses. We'll end our PowerPoint with this, and we'll do a very, very short group quiz. Okay, 10-question group quiz. It'll be easy. I'm going to keep the stuff on the board to help, okay? Look at these top 4 classes, guys. Can we all remember really quickly that shoulder and hip is a ball and socket? Not too bad. Radius ulna is a pivot. Where else do we get rotation? What about C1, C2? Right, so C1, C2 and radius ulna for pivot. Not too bad, right? Hinge joint would be elbow, knee, and fingers and toes. Elbow, knee, fingers, and toes, hinge joints, meaning they open and close like a hinge. They don't rotate. They don't move side to side. They only go one way or the other, like a hinge, right? So elbow, knee, fingers, toes. Is that fair? And then plane joint, which is also called a gliding joint. This is going to be the blocky bones of the wrist and ankle. These are the plane joints or gliding joints. Those are the 4 main ones I need you to know. There are 2 other ones that are a little more complicated, but those are the 4 main ones. The other 2 I'll show you real fast. The base of the thumb is considered a saddle joint because it has a little bit more motion. And then the condylar joints. The condylar joints are kind of like a ball and socket joint, but not enough movement. So condylar, look at these big knuckles here. That's a condylar joint. The occipital bone, the condyles we saw there, that's a condylar joint on C1. So where we see a rounded surface, not as round as the humerus or femur head, but a little bit rounded, is a condylar joint. So just know the knuckles and the occipital joint for your condylar joints. The base of the thumb, saddle joint. Those are 2 more difficult ones, but guys, I'm more focused on those top 4. Ball and socket, shoulder and hip. Pivot for radius ulna. C1, C2.
right? Hinge for elbow, knee, fingers and toes. And then gliding would be the wrists and ankle bones as they glide across each other. And one last one is these facet joints of the spine are also gliding because they're flat. These are flat surfaces that just glide across.
Which one did you say gliding is?
Wrist, ankle, and then the facet joints of the spine. The plane is gliding, same thing. Yes, ma'am.
And the-
Radius, ulna, C1, C2. I got other pictures for that. Here are the ball and socket joints right there of the shoulder. And this is an example of a condyloid joint here in the occipital bone where it meets C1. Then we learned the condyles meeting C1. That's condyloid. Here is a hinge joint. And there's a pivot joint. Our quiz is based on classifications, no pictures on the quiz, okay? So I know you'll need to review all these. I know that. But can we all agree all that we're talking about here, all these are synovial? Right? These are all synovial, therefore they're all diarthrotic. That's where your quiz is pointed to today. And where were all those special features? All the bursae, the menisci, the tendon sheets, all that stuff, the labrum, where were they all part of? All part of synovial joints. They have to be because they all have movement. Okay. This is just a review. Notice which one are in caps, which means you should definitely focus on those. Yeah. Yeah, I'm about to. Yep, right now. Absolutely. Here we go. Ball and socket joints, shoulder and hip.
Do we know their movements?
Nope.
Mm,
Nope. Just know they're synovial, diarthrotic, and know the subclasses, shoulder and hip. Plane joints, wrist and ankle bones. And then the facet joints, meaning the back joints of the spine.
Do you want us to know that it's intercostal or just wrist?
It on the test, it could say intercarpal and intertarsal. Yeah. Inter just means in between the carpal bones. Yeah. For hinge joints, knee, elbow, even the ankle and jaw are considered hinge joints.
Wait, so it's the ankle or plane?
Ankle, well, the bones of the ankle in between the bones, that's why I said intertarsal, those are plain. But where the talus, I don't have one here. Where the talus meets the tibia for your ankle going up and down like this, that's a hinge. That's the difference. But to be fair, who was that said that? Yeah, Sarah? Okay. To be fair, I'm interested in elbow and knee for those. That's how I'll test you. Elbow, knee, and the finger joints. For the pivot, it's easily going to be radius ulna pivot joint, C1, C2 for rotation. And then for those are the big four guys. These last two are the ones that are more difficult. The condyloid joints will have condyles, like the knuckles, rounded edges of the bone. It's a condyle. So the joints for digits 2 through 5, they're called MCP joints. And then your occipital joint right there. So that's why you're going to probably need to come back to this one. Saddle joint is specifically for the thumb, the base of the thumb. We end this chapter. This is not on your quiz, guys, but we do end this chapter with 3 types of arthritis. Let me just run through those 3 really fast. I'm going to make it as brief as possible. We have to know which arthritis is degenerative versus inflammatory. Osteoarthritis is the degenerative kind. This is the regular, hate to say regular, but the everyday arthritis that everyone tends to get at some point in their life. This is a loss of cartilage. So look what's in the bold, the red and the underlined, right? A loss of cartilage is osteoarthritis. This is degenerative because it just gets worse. This is the everyday wear and tear, the lack of motion, the stiffness. When people say they feel stiff when they get older, this is osteoarthritis. It just means they've lost some of the motion, they've lost some of the cartilage in those joints. This is the kind that's reversible with motion, with correct motion. So with correct motion, you got to correct the joint first. So to be honest, it's improper to do physical therapy before correcting the joint with chiropractic. You know, there's a rule of therapy that should be followed that is not always followed. That's why physical therapy, it only lasts for the 6 weeks that you do it, right? Because those people normally have not gone to a chiropractor to fix the joint first before they start moving it. It's pretty basic. It's just so many people just don't pay attention to the basics, and it really bugs me. It really bugs me. So rheumatoid is an altogether advanced arthritis. This is the worst that we're going to see here in this course. This is the deformatory arthritis. Look how the fingers deform, guys. This is full inflammatory arthritis right here. This is what you need to know about rheumatoid. This is inflaming all the tissues, the ligaments, the tendons, the cartilage, all the tissues, guys. This is inflammatory. Tends to be autoimmune, which means the body's fighting itself. Very hard to treat. It really doesn't go away. Certainly not reversible unless you pray everything you got. Maybe that'll do it, you know. But very hard to treat is rheumatoid. This is inflammatory, meaning all the tissues inflamed. Okay, that's it. We did it.